As Kenya gears up to achieve universal health coverage by 2022, questions as to whether the great plan will crystallize or fizzle out abounds. In the plan, every Kenyan, irrespective of where they live and their socio-economic status, will access good quality health services without having to go through any financial hardships. It is a journey that Health Cabinet Secretary Sicily Kariuki says is well on course, saying the government remains committed to ensuring Kenyans have access to preventable, promotive, curative, rehabilitative and palliative health services at minimum financial burden.
Universal health coverage is a declaration that the world reached through the SDG number 3, where it is the intention of world leaders that by the year 2030, universal health coverage across the globe will have been attained.
The model has 3 key elements that include equity in access to healthcare in terms of geographic coverage and the range of available health services, high-quality health services, and financial protection.
Precisely, His Excellency the President will be launching UHC pilot phase in Kisumu on the 13th of this month. And the reason he's launching in Kisumu is because we have 4 pilot counties where we are starting on UHC. But the reason we are taking on a pilot approach is also because we would like to simulate near ideal conditions within these 4 counties and be able to then pick lessons as we execute the pilot phase of UHC.
3.2 million Kenyans drawn from Kisumu, Isiolo, Nyeri and Machakos counties are set to benefit in the pilot phase of the program with their choice based on disease burden.
Kisumu was selected because it has the highest disease burden in terms of communicable diseases, malaria, tuberculosis, HIV. Beyond Kisumu will be Machakos. Machakos was picked again because of the high incidence of trauma cases. Accident-related patients are quite many within the county, and you can look where it is located, Nairobi-Mombasa Highway. Nyeri was picked because it has the highest disease burden of what we call non-communicable diseases, and in particular, diabetes. And finally, we picked Isiolo because Isiolo is peculiar, being where the population is pastoralistic. You will today have patients attending to clinic X or facility X, but depending on the rain pattern, they will move with the animals, and therefore, they will migrate, and perhaps even where they were supposed to repeat, immunization issues or antenatal visits, you will find the population has veered off because of the nature of the population.
But what role will devolved units play in the new initiative?
The approach that we are to pursue as a country is one which requires us to focus on the primary health care structures. It is one which also requires for us and the people who will be giving service, that is the county or the facilities, to also be able to invest a little more within the executing of what we call the community health strategy, where we bring communities at the center of decision making, and we bring the individuals or the patients to also be at the center of decision making and taking on matters of health also as their responsibility. And so the persons that will be responsible for delivering service on a day-to-day basis are actually the county governments. They are, so to speak, the investor. They are, so to speak, the service provider. They are, so to speak, the people who deal with problems or complaints from the patients as a yoka.
Kenyans will, however, be expected to register for UHC before receiving healthcare services.
We have contracted NHIF to register the population or the residents of these 4 pilot counties and issue them with what we call the UHC identification card. That card is important because when you present yourself to a public facility, then even before you get into the database, it's important that you, on the face of it, you can tell that you're actually a resident of County X and that you have actually been registered, meaning then your details are to be found in the NHIF database. Likewise, a UHC card, for purposes of the pilot phase, we are following exactly the same modalities that NHIF follows, so that the residents of, say, Machakos are being required to appoint 1, 2 facilities of their choice, preferably from where we sit, facilities which are closest to them. The second institution, which is very important and the ministry, is the KEMSA. KEMSA is responsible for ensuring quality and timely pharmaceutical products and non-pharmaceutical commodities are available in the facilities.
The county government of Kisumu is laying the foundation for the launch of a pilot phase of universal health coverage by President Uhuru Kenyatta next week. The program will enable residents to access the NHIF cover for quality health services as envisaged in Governor Anyang' Nyong'o's manifesto and in line with the national government's agenda. Kariuki says Kenya is benchmarking with countries such as Ethiopia and Rwanda, where the concept has proved a success. Purity Museo, Channel 1 News, Weekend.